Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate bone and lung cancer patient slash survivor, uh, and doing very well, but I'll give you a quick update in a second. Been dealing with cancer since early 2021, uh, and I have learned so much through this journey, and I'm so thankful that not that I got cancer, but I'm thankful that I've got the experience of having the YouTube channel and meeting so many incredible people along the way. And that's what it's all about to me is sharing the experience and helping people. Um, I recently had some scans. I had a bone scan and a CT scan, and the CT scan came out fine, and the bone scan showed some metastases, but it just got me refocused. I'm just refocused on what I need to do and back to doing what I started with, and I feel everything's going to be fine. I actually have a consultation with my oncologist tomorrow, so I will give you further updates. But as of right now, everything's looking good, and once you've gone through cancer, you know what to do. And so at this point, I have a lot of confidence moving forward that we can knock it out again. So I am so excited for my guest today. And in fact, she's a dentist, and I've never shared this on camera, but at one point, I graduated from college with a degree in biology, and I did get accepted to about 5 or 6 dental schools and turned out not to go because I changed my mind after working as an assistant. And I said, there's no way I could do this for a living. So I changed my mind and here I am. But I am so happy to introduce to you Dr. Parul Dua Makkar. Can you please introduce yourself, tell us a little bit about yourself, and then let's get into this conversation because this is going to be terrific.
Uh, Thanks, Mark. Thanks for welcoming me to your podcast. And I'm so excited to be here. And I'm glad your scans are coming out good and, wish you positive news tomorrow. But yes, cancer journey, not something that I have traveled in myself personally, but I've watched my only and younger sibling from the sidelines. And he was diagnosed in 2019 and unfortunately passed away at age of 34 in 2021. And he was a dentist like myself. He had followed me into the foots of dentistry, and dentistry kind of led him out. He died of metastatic oral cancer stemming from his tongue, and that eventually ended up metastasizing. And he was gone within a year and a half of diagnosis.
Oh, that is terrible. So sorry for your loss. That is really rough. So let's start from the beginning of his story. And what we're going to do in this interview is we're going to get a different perspective, not the perspective of the cancer patient, but from a sibling trying to do the best they can with the situation of a younger sibling having cancer. So how did it start? How did his cancer journey start?
Well, like I said, we're both dentists. So he in 2019 showed me his tongue, like you and I are talking, and he sent me a picture and he said, I got this thing on my tongue. It's been there for a little while. It's bothering me. And I showed it to a whole bunch of oral surgeons that I know, and everybody hands down was like, this is cancer. And I told him, and he was 32 at the time, shy of his at the end of the month, he would be 33. So he's like, I can't have cancer. Like, are you kidding? I'm healthy. I'm in my 30s. I have my practice. I don't have time for this. I don't have it. And I think part of it is denial, especially in the younger generation. And I played, I'm like, okay, you've got, you're a dentist too. You've got an oral surgeon looking after you. So okay, I'll see you next month, which I fly in the summer, so I was going to travel anyways in July. And when I saw the tongue again, I looked at him because this lesion, what he showed me to what it looked like when I saw it physically, was like 10 times the size. Half his tongue was eroded, brown, leathery, and I wish I had taken a picture of that. And I looked at him, and he had just bought a house. We celebrated his birthday, it's all good things. But then I looked and I'm like, are you kidding me right now? Like the older sister, like, what? Um, and he's like, I'm doing the biopsy. I'll do it when you leave. I'm not doing it right now. And he had been on prednisone for about a month. So he was being, these are the points that I stress on to other healthcare providers when I talk about awareness for oral cancer, not to, and for self advocacy also, um, not to get treated or provide treatment unless you know what you're providing treatment for. Here we had a lesion. He got his wisdom teeth pulled out, but never a biopsy. And he was on prednisone, which is an immunosuppressant. So it probably made his cancer worse, rapidly spread. And by the time he was diagnosed in August of 2019, it was metastasized to the neck. And so he had this major
So
8 hour.
let me pause you right there. So when he showed you, I guess it was on Zoom the first time, what kind of time period was there in between that first showing and then when you saw it in person?
A month.
A month. Wow.
Um, maybe 5 weeks, or it was like June 5th. He showed me I flew. I know when I flew because it was during Stampede, which is the first 2 weeks of July. So I want to say 5 weeks, maybe a month and a half, 6 weeks, but definitely not longer than that. So it spread pretty quickly, and so this is why I attribute the prednisone, because he was on prednisone for a month from the initial lesion. They're like, yeah, it can't be anything. Let's just put you on prednisone. It'll be fine. Let's check out the wisdom teeth. Maybe it's rubbing against your wisdom teeth, and that's why it's irritated the tongue area, but never a biopsy. And that's the only true way to detect any form of cancer under the microscope. So, so he got this major operation. Half his tongue was removed and grafted from his arm. It was 8 hour surgery, team of surgeons who did beautiful work, but he never got chemo radiation post. Again, it was left to him, and he's like, I got this. It's all taken out. I've recovered. I want to get back to my life. And he was a solo practitioner. So he started seeing patients. He flew to see me in September, and he was seeing patients October 1st. So within a year, month and a half of getting the surgery, he was back to, but he did have mental fogness. And I'm sure, you can relate to that after surgery. He had some numbness tingling on his left arm where he was grafted from. And when I saw him, he had a slight lisp. Tongue had different colors, different lengths, and he had a trach, so he had scar tissue, still had stitches and all that. But he was in good spirits. He's like, I've beaten cancer. And I was so hopeful because one of my paternal grandmother died of cancer. And so when Manu was initially diagnosed, my dad asked me, he's like, is Manu going to die? And at that time I said, no, he'll be fine. They're just going to take this lesion out and they all survive, because I know cancer survivors. And I said, of course, Manu will not, he's healthy, he has no comorbidities, he's young, he's going to be fine. He's going to be okay. And my dad was so scared because of having lost a parent to it. And unfortunately, in March, when COVID hit, in April 1st, he was presented with swelling on because he did have lymph node involvement. So there was swelling in his neck and there was positive for cancer. So there were some cancer cells left behind. And had he gotten, hindsight's always 2020. Maybe if he had gotten radiation chemo, those cancer cells would have not, presented so quickly within months of the initial surgery. And that's when he made a conscious decision COVID's hit, dentistry is closed, offices were closed, shut down. It was unpredictable times. Borders were shut between US and Canada. He decided to sell his practice. And he decided that
Let me pause you
I'm
right
just going to
there.
quit dentistry. Mm-hmm.
Um, so when it seems to me that when cancer is in the mouth, does it tend to spread quicker than in other areas? It
It
does.
is.
Why is that?
It's a very highly vascular structure. There are a lot of very essential structures close proximity to the brain, to the lymph system, and cancer spreads through your lymphatic system and through blood. And Manu already had lymph node involvement. He already had metastasis there. So it just, where's it going to go from here? It went straight to his lungs and it metastasized to his lungs. And that was another mistake I felt that with the Canadian system is that when his cancer had returned in the midst of COVID, then initially April, we had that neck biopsy done because he had a lesion. When they did the CT scan of his chest, they found a ground glass opaque lesion on his chest on the same side as the tongue lesion, indicating some sort of metastasis, but it was kind of blown off to the fact that it's COVID and he's coughing. And they said, we'll just evaluate it in 6 months, which turned to 7 months. But it was too small to biopsy. By the time they did another CT scan, the lesion had grown 4 times the size. And from 0.8 centimeters by 0.6 to 4.1 by 3.8.
Wow.
Within 7 months. So already cancer cells, so it was traveling it went from the tongue to the neck to the lungs. And he actually never got the biopsy. He ended up in the hospital with failure to breathe. And the reason was he had fluid buildup in his lungs because the cancer was spread into his lung lining and it was deemed inoperable. And it showed metastasis. They finally did a PET scan, metastasis down to his pelvic bone on the same side, on the left side of his body.
Wow.
So,
Eh,
and that was in December of 2020.
So being a dentist, how often do you see signs of cancer in people? Is it rare or what has your experience been?
I mean, it's definitely, traditional symptoms or people who you would think are at risk are your smokers and alcohol, older men, and men are more susceptible. But there has been an increase, especially with vape use, with chewless tobacco, hookah use, and the biggest being the human papillomavirus, the HPV, which has caused a certain surge of cancers. And so now in females, you're always getting a cervical um, cancer. I mean, you're doing a pap smear, right? And that's testing for cervical cancer. So you're getting a test for it, whether you're susceptible or not. But for oral cancer, isn't a test per se to say you're at risk. And so these cancers are very hard to detect unless you're actively screening. You don't know, so your dentist needs to be screening you. And sometimes these lesions, they're just persistent. A lot of the oropharyngeal, the posterior area, the HPV related, are like the back of the throat, like the tonsillar area. And those are hard to detect. So unless you have a symptom like a hoarseness or trouble talking, constant cough, or moving your tongue, or your jaw pain, a earache, unilateral, or some sort of node, you feel like, oh, I feel like, something's inflamed. Unless you have like a particular symptoms, these cancers often get missed. So anything that's in your mouth's not healing for like 2 weeks, a red or white lesion really needs to be checked out and get in a biopsy. And nowadays we're so lucky. There's so much technology. You see something, take a picture of it with your camera, phone, and you can show it to your dentist. Like, hey, this is what I saw. What do you think it is? Um, and usually your dentist should bring you back in 2 weeks or say, let's get you a biopsy ASAP.
So as a dentist, do you do biopsies?
Yes.
You
And
do.
it was only, yeah, and it was only after Manu's death that I felt the need to be a little bit more proactive. And instead of having patients like, oh, you need a biopsy, go to so and so, and then patients forget. Nobody wants to do a biopsy. Nobody wants to do a biopsy in the mouth, let alone you. Nobody likes to go to the dentist to get their teeth cleaned. Forget a biopsy, and then it's difficult eating, drinking, and the anticipation. So while they're in the chair, I'm like, listen, I'll do it for you. Let's do it now. Let's do it 2 weeks, whatever. Let's do it. Um, because the time is of such an essential essence of this particular cancer because it's so aggressive and it spreads very easily. And so by the time the symptoms are presented, like oral cancer is detected 77% of the time in stage 3 or 4. And the mortality rate is
Wow.
like 50 to 60%. So only the cancer detected at stage 1 and 2, it's only 20 some percent. And they survive, they have a better survival rate. So I'm like, don't wait till after your holiday. Don't wait till, you've got your kids' party. Let's just do it now. Let's know what we're treating.
Why do you think that oral cancer is so aggressive?
I think it's it's to just the most type of cancers are the squamous cell carcinomas. The squamous cell is like, the tissue lining. It's such a highly vascular area. I mean, the head and neck is just super vascular. And that's why it's just cancer cells love it. They just keep spreading. And there's nothing like, and it goes so undetected for such a long period of time. It's not like a mole that just sits there and then you just monitor it or you change shapes or sizes. It's in a hidden part. It's just, it's a thin tissue in certain areas and it's just such a highly vascular area that it spreads so rapidly.
Do you think I'm really learning a lot, so thank you so much for sharing that. I didn't know about this. It makes sense to me that one of the reasons it could be spreading so rapidly is because it's so close to its food source. So one of the things that cancer feeds on is sugar. And
Hmm.
since it's going directly into the mouth, it's directly in contact with the food that we eat. Is that
Yeah,
a reasonable
definitely.
assumption?
That's a great assumption. Cancer loves sugar. And one
Mhm.
of the things that Manu, towards the end of his life, was very particular about no sugar consumption, zero. And this man, oh my God, lived on chocolate. He come to New York and I'm like, what do you want to eat? And he's like, oh, take me to Serendipity. I want the dessert there. And, he would save all the chocolates and put them in the fridge and wait till everybody's kind of gone away. And then he would just eat in peace, like he'd enjoy food. He was a foodie, he loved food. And so to watch him towards the end deny himself of those simple pleasures was such a hard thing. But he went on a keto diet and he was so particular. He's like, I'm going to not eat the pizza toppings. Sorry, not eat the pizza crust. I'm just going to eat the toppings. I don't want any carbs, any sugar. And so, yeah, the HPV virus loves to hang out in the tonsil or crypts, and it just kind of hides there. And yeah, there's a huge exposure to sugar, and cancer just grows.
Wow. I'm glad I'm asking these questions because I'm learning a lot. And that's what this is all about is learning. That's why people are tuning into us to learn different things. And thank you for sharing that.
Of
That's
course.
great to know. And so many people have this perception about dentists, you stay away until, something's hurting you. But it's so important for us as human beings to be on top of our health. And I I'm a big advocate now for for doing that because I realize how important your health is. I didn't realize that before. Your health is everything, absolutely everything. Because
Yep.
if you have your health, then you could, you have the opportunity to fight another day. And you have that
Mhm.
opportunity of a day of time to, um, do what you need to do or do what you would like to do and move forward. But if you're in bed on your back, which I have experienced, it's just such a totally different ball game. And so, um, there's so many aspects to health. I mean, there's uh, mental health and oral health and physical health and you name it all and on. And it's a hard thing to do with, when we're working and trying to raise a family. But it's trying to achieve that balance and trying to keep ourselves healthy enough to stay in the game. And that's the way I look at it now is I'm going to do everything I can because my health is that important. So I mean, I could see it coming from your standpoint as a dentist, um, and the perception that people have of dentists.
Yeah. Health,
It's not
health
the
is wealth.
easiest thing. Yes, it
Health
is.
is wealth. And the oral body is connected to the rest of the body. And I think a lot of people fail to acknowledge or realize that. Same thing with teeth. Like when I tell patients you have a cavity, they're like, but it doesn't hurt. I'm like, of course it doesn't, because the nerve of the tooth's in the center of the tooth. So unless the cavity is spread that far deep and then starts breaking or chipping or getting into the nerve chamber, you're not going to feel anything. And by then it's either extraction or root canal. But you know, oral health's linked to diabetes, to dementia, to stroke, to Alzheimer's, like a whole host of things during pregnancy, low birth rates. So there's so much more than just like, oh, you're going in for a checkup and cleaning. Your dentist can save your life.
What are your thoughts and what are your thoughts on root canals? Um, I have a friend of mine who's a biocompatible dentist in California, and I got a root canal years back, and he said, "You have a root canal?" And he said, I would suggest getting it replaced with a uh, what do you call that?
Implant.
Implant. Yes.
Yeah. I guess I'm a little old school in the traditional thinking. Yes, I know a lot of biomedical, it's the right word I'm looking for. Biological dentists, I do know of, and they will talk about implants and not even titanium implants, but ceramic, non-metallic implants, like doing composite fillings instead of amalgam. And I've walked away from, doing amalgam fillings in the mouth. But as far as root canals, I mean, honestly, I mean, just generally speaking, I think that nothing replaces whatever you've gotten naturally, God given. Nothing's going to replace your tooth. Anything artificial is ever going to be the same. Implants have their own. They're a great option, but they also have their own problems. Here's an interesting fact: implants fail. Like anything, nothing in life is guaranteed. It's a mechanical. You're putting something artificial in your body, and they do fail. But some oral surgeons have found that the site of the failed implants, those sites have become squamous cell carcinomas. So, so there's a lot of, more research that needs to be done on that aspect. But as far as doing root canals, I do them all day long. I always say, like, you want to save what you have because once the tooth's out, it's out. Then you've got an implant in. You lose a tooth, you lose bone, and then you're looking at a bone graft. Then you're putting another artificial thing in there, right? So there's always, I, I would always want to save the tooth rather than, of course, if it's not savable, then yes, we need to extract and put an implant by all means. But if it's savable, I would keep it. And if the tooth's not bothering you, if it's asymptomatic, like a person's had a root canal done 10 years ago, 15 years ago, and it's asymptomatic and is doing well, I don't see a reason to take it out and put an implant in and do surgery. right? If it's failed and you've got an abscess and you need a retreat, okay, maybe yes, I'd consider an implant. But if it's doing well and it's serving your purpose and it's looks good on the X-ray, leave it alone.
I had an implant, I mean a root canal done, and so after listening to my friend who I went to undergrad with, and he and I both were studying to become dentists. He became one, I didn't. And so he, convinced me to get my root canal taken
Root canal.
out. And that was after like 6 months. And I was like, man, I just got this thing in. He goes, man, and this is just, everybody has a different school of thought. So I got
Yes.
it taken
Yeah.
out, and it was so fortunate that I did, because the dentist who put it in left a piece of wire
Yeah, the
in.
part of the yeah, part of the sometimes that happens. It's part of the instrumentation. Yeah.
Right, right. And so it was in there, and it was a pretty good sized piece. I was like, I couldn't believe it when I saw it.
Yeah.
So it was actually, for me, it was really
Right.
good that it was taken out.
Right.
And then I got an implant probably 7 or 8 years ago, and it's been fine.
Yeah.
So yeah,
Yeah, no, and unless of course there's something wrong with it, yes, by all means. And you know, things happen. It's
right,
it's a
right.
practice of dentistry. Yeah.
I'd like to ask you this right now.
Yes.
There's a lot more that I would like to talk to you about concerning your brother and your brother's situation. Would you come back for a part two so we could,
Of course.
give it enough time and share what we need to share? So let's go back to your brother. I mean, I really enjoyed what you said, and I really appreciate you sharing this information, because it's fascinating to me. So let's go back to your brother. So once you saw him, let's talk about how you were feeling in dealing with your brother who lived away from you.
So I mean, at the time when he was first initially diagnosed, I was like, no biggie. I told you the conversation with my dad. But when the cancer returned, I got really worried because it was also the time we lost a grandparent. Manu and I lost a grandparent. And so now I know my parents were dealing with the loss of their own parent and Manu's cancer returning in this uncertain time of COVID when we didn't know. It was a rough instance because I don't know what was happening with my practice. I had just done a startup. Here, the governor has shut down. We're not essential, but liquor is essential. And so it was my parents were like, don't come, don't travel. We're already losing Manu and he's immunocompromised. You can't be around him. You can't travel. It's not, for your listeners, I live in New York and Manu lived in Calgary. So we're on the other side of the coast. So it wasn't something I can just drive to. And it's a 3-day drive. So it wasn't, flying was the only option. And there was obviously a lot of worry about that. And I wasn't vaccinated. Vaccines weren't available at that time. So they were concerned about possibly I'm contracting. New York's the epicenter. Their dead bodies being thrown out of the hospital. That's the images being shown. So they're like, you stay put. And then, so there was a little bit of a guilt attachment. I'd hear my elderly parents, they're kind of reliving the trauma of having lost a parent to, they lost my mom lost her mom, and my dad's thinking about his mom who had cancer. And so there was a lot of guilt and a failure in a way that, hey, I'm a dentist and I couldn't get him to get an earlier biopsy. What if I'd been living closer? Would I have gotten him quicker? Would he have listened to me rather than just kind of like downplaying it? I think denial was a big factor in his treatment. He just wasn't ready to accept that he could have it. Um, and no 30-year-old should have to deal with that. No young person should, especially if you don't have this, any of the risk factors. And when Manu's cancer spread into his lung lining, and in December, when he was admitted, we got the PET scan, and the PET scan showed metastasis down to the pelvic bone. I showed those scans. I was in communication with other doctors. Like I would get his reports and I would share with my friends who were physicians. And there's a couple that I attribute a lot to, that he's an internal med and she's a radiologist. And so I texted them. I'm like, look at Manu's PET scan. What do you think? And my friend, the internal med, called me up. He works at a hospital here in New York. And he's like, get on a plane. You don't have time with him. Just drop everything. And I'm like, I can't drop everything. I need PCR testing. At that time, the only way to cross the border, I'm a Canadian citizen, I could cross, but I had to have a good reason that I'm coming for a Canadian citizen. That is a life-threatening, because I wasn't a healthcare provider, as a dentist. I wasn't a medical healthcare provider, like a doctor, physician. So there were certain protocols. It's a 6 or 8 page permission from the government of Canada that has to be signed off, not only by Manu's doctors, but by Manu himself, because where are you quarantining? At that time, you had to quarantine. Canada was very strict. You had to quarantine 2 weeks prior to in a hotel before you could go into the house. So that was a
2 weeks?
mandatory quarantine. 2 weeks,
Wow.
14 days. So you had to get a PCR testing, which took 3 days. You fly, and then you have to quarantine for 14 days before you can actually go visit anybody. Because at that time, 14 days was if you don't have, you're asymptomatic, you get tested, whatever. So that wasn't an option. And the only other way was if you come on a compassion release basis. And for that, you need all these documents signed off. So my parents signed off that, yes, we take responsibility. You're going to come to my house. AirCan, you had to log in every day. They would call you to check in on you where you're quarantining. And Manu had to sign off that she can come to my house. And my parents weren't willing to get that done. My parents are like, nope, no, you're not coming. Manu's in the hospital. He's getting a chest port placed in. You're not coming. You're not coming. I didn't have the heart to tell them what I knew because they were living it. They were in and out of, dropping him for chemo, for radiation, taking him in and out of the hospital for this the port that was being placed. And at that, my dad would not even listen to me. He's like, you have young kids. You're going to fly. Again, Manu's immunocompromised, the whole spiel. I wrote him a letter. I wrote him an email begging him. I said, this is my only sibling. I did not come for the initial surgery. I did not come for the second surgery. I could not put down the words that he may die soon, but I was like, I need to come see him. I will wear a mask. I will take all the precautions. I will do everything in my power to stay safe, but I need to come and you have to let me come. That's the only other family I have. And so they finally said, and then he signed off the papers. That's what it took. And then I flew. And I'm so glad I took that flight because Manu had started writing. He wasn't able to talk very well with the fluid. It had to be drained once a day, about a liter. And he would text most of the time. We just sat and watched movies and listened to songs. And that's when he talked about that, how he had been blogging his journey and he wanted this to be made into a book.
We're going to
And I
talk
said,
about that in part 2. So
yeah. And
let's
he
save
said,
that.
yeah. But I'm so glad that I got those I got a week with him. And and he would talk to me. He's like, okay, here's my, planning wise, like these are all my papers. I want you to know you're my beneficiary. You're this, you need to know about that. And I'm like, I don't want to talk about it. Death was knocking. He was aware of it. I was aware of it. We just didn't want to open the door. And I said, I don't want to talk about it. Let's talk about what you want to do. And this was December, and Manu had bought a Porsche for himself when he beat cancer the first time round. And I told him, I'm like, you haven't gotten out of the house. I'll take you out for a drive. Today's a nice day. He's like, no, the Calgary air, the cold air hurts me to breathe. I can't breathe outside air. I just want to stay here. And he had a view of the mountains, and he's like, I'm happy here. I don't want to go anywhere. I don't want to talk to anyone. I'm fine. I'm like, okay. And and so then I saw him. And sorry, I didn't see him. He got admitted in January of 21 for 2 weeks in isolation. Um, and then I I did something sneaky. I took all his medical information down. You know, Canada has a medical number and stuff that you can, and it's traceable because it's a universal system. And I had my pulmonologist friend in Canada, my friend's husband actually. And I said, can you go into his charts? He's admitted for 2 weeks. And Manu was so protective of our parents. He didn't want to share what his body was going through. And he told the doctors and the nurses, do not talk to them, do not release any information. I will tell them on my own terms. And so he wasn't talking to me, he wasn't talking to anybody. So in desperation, I said, can you log in? Can you find out? And I was at tennis class with my son when I got the report back on a Sunday. And it was a 14-point report that my pulmonologist friend, looking at the PET scans and the reports and all the blood work, and he basically said, how the cancer had just was eating him from the inside out. I don't think I got through those 14 points. I was on the floor hyperventilating, and I had my husband finish it for me. I'm like, you read it. I can't read it. I just read the 4 points. And it was basically saying, you need to make end of life decisions. It's a matter of time. And again, this was having an only sibling. Um, of course, all that guilt and everything was attached. And I'm sitting here in the US. I've got, now at this point, I have a vaccine and I'm vaccinated. Um, Again, I could not share this with anybody. I couldn't share it with my parents. My kids are too young. My husband's being as supportive as he can, but and I couldn't call another sibling and say, hey, Manu is dying, let's do something. Let's like go there, you take turns, nothing. I just sat there with a report and just be like, this is it. And it's just a matter of time. And
I'm gonna pause you right there because
yeah,
we'll pick this up next time, but I have one last question for you.
sure.
And it's going through what you've gone through, looking back, would you have done anything differently?
Yes. I know I know that I could not control COVID with the border shutdowns. And it's the worst of situations, the worst timing. I mean, the worst circumstance. I know I could not control that. But in 2019, when Manu showed me the lesion, I wish I had flown down and got him the biopsy right away. And the other thing I would have changed was when he got the initial surgery, I wish I had gone there and been with him. You know, I think I downplayed how aggressive because I was so positive. I was like, he's got this. I mean, he played rock like he was a tough kid, like mentally and physically. Like people who don't know him, he was like 5'2", but stocky. Like he was built like a tank. And he played the hooker position in rugby. I mean, you would see these 6+ guys just plummeting on top of him and you'd see him sneak out of there. Like he spoke his mind. He was very strong physically and just very determined in his ways. And I thought he got this. I'm like, Manu can beat anything. He can survive anything. He went through first year of dental school on crutches because he had an ACL tear. And, by the time he got surgery, he was in first year of dental school. I'm like, this kid's got it. There's no, he's faced so many challenges in life. there was no doubt in my mind he'd beat this. And he and you and I would not be having the conversation. He and you would be having this conversation. I just never in a million years would have known that he was, that I was going to outlive him. It was, so had I known, I definitely would have been there more.
Unfortunately, we cannot change the past. And but we need, it's great to learn from. But I just want to thank you so much for sharing your incredible story. And we're going to pick it up next time for part two. And what I'd like to do is I'd like to thank each and every one of you out there for joining us. And we look forward to another exciting interview, an informational interview and emotional interview from Dr. Parul. And she's got so much more to give. And so what I wish for everyone is I'm going to be starting kind of like a new real quick segment at the end of the interviews. And I'll tell you what that is next time. But make the most out of your time on Earth because it goes by so fast. I mean, I look at myself now uh, and I'm 66, and it seemed like yesterday I was in my 20s. So uh, time is so precious. It's our most valuable commodity. We all have the same 24 hours in a week, in a day, and it's a matter of how we use that time because time should not be wasted and used appropriately to do the best we can as human beings to help each other. But thank you for joining us here at To Be Your Own Hero. Please subscribe, like, make a comment in the comment section, and we will see you next week on To Be Your Own Hero. Have a fantastic week. Thank you.